One of the other procedures that I offer in the practice is brow lift surgery and eyelid surgery. I usually combine these together because those areas of the face are quite close and they usually form a unit. So the type of patient who will approach me for brow lift or eyelid is usually those in their mid to late 50s and 60s. In men particularly, the brow is quite strong. The brow can actually descend and obscure the view of the patient, cause problems with the patient's eyesight or view. How do I correct the brow? There are 2 or 3 methods that have been described, but most commonly in my practice I'll do an endoscopic brow lift if that is required. Very rarely will I do a surgical brow lift, very rarely, but most patients would suffice with an endoscopic brow lift. The other technique as well, which I've used but not often, is doing a brow lift using what we call a transpalpebral approach, so an incision through the upper eyelid. So the soft tissues are released from the underlying bony framework. The temporal crest, which is a line along the skull where the soft tissues are strongly adhered to the skull, are released, so that enables me to elevate the tissues and reposition them, providing youthfulness to the face. With regards to the eyelids, I tend to be very conservative. With the upper eyelid, I would remove the required amount of excess skin, but then using special stitches, reposition the brow fat. As we know in youth, the brow fat lies, it's full and it lies slightly higher up. So using a special suture technique, I would place the stitches in such a fashion that the brow fat is elevated, giving the face a youthful look. In terms of the lower eyelid, you could have prolapse fat or excess skin or descent of the eyelid cheek junction that leaves the patient looking fairly tired and old. The techniques that I use is a combination of a cutaneous approach, so in making an incision on the skin, or a transconjunctival approach where I make an incision inside the eyelid, and then through that incision I reposition the fatty layers from the orbit, and by so doing giving the patient a youthful look. These procedures again, they come with risks, and it's very important that the patients are aware of the risks that they're taking. These again commonly include infection, bleeding, hematoma, problems with vision, asymmetries, scarring, and in the worst case scenario, particularly with the lower eyelid, blindness. But that's 0.001%, so a very low risk. I advise the patients to use ice packs on the face to cool the face down, to sleep when they're sleeping at home, to use 2 or 3 pillows to keep the head elevated for at least a week, because that allows the swelling to reduce, and again to keep the eyes moist and irrigated, so I'll provide them with some eye wash and eye ointments. And again, I see the patients at 1 week, 6 weeks, 3 months and 6 months. For more information, please visit the website at www.ivogwanmesia.com.